How you doing, guys? If you're a runner and you're suffering from knee pain, whether it's at the front of the knee, the back of the knee, or the inside of the knee, in this short video I'm going to explain 3 things that you can do to try and help yourself and keep yourself running. The main thing what we see with patients coming into the clinic with knee pain from running is that they've generally just increased the distance. If you spike your distance too much, your knee's not going to be able to cope with it. The muscles are not going to be able to contend with it because you're running for longer time and longer distance. And then what happens is instead of the muscles taking the load, the knee takes the load. And type of pain that you can kind of feel in it is that sharp pain in the front of your knee. You might feel it going up and down stairs, especially in the morning time, and you're going to feel some swelling, or you might have some ache in the inside of the knee from walking. So what can you do to help yourself? Well, number one, if there's swelling in there, you need to get the swelling down. So get a bag, sandwich bag with water and ice, lob it into it, put it on your knee, hold it there for 10 or 15 minutes. That should try and take some of the swelling out of it. If you're quite active and you want to keep moving around, you can pop on the bike, keep the saddle quite high, and just get that knee moving, and hopefully it'll push a little bit of fluid out of it. Second thing you can do is do a warm-up. What warm-up should you do? Look, there's a million videos on YouTube of how to warm up as a runner. You've just got to identify what level of running you're at. Are you an experienced runner? Are you a sprinter? Are you a long distance? Are you 800-meter runner? You just got to figure it out from there. Second thing from there is if you're actually just only sore when you're running and the pain is coming on in the middle of the run or towards the end of the run, then the easiest thing is to reduce down your distance, but run that distance a little bit faster. Now, why is this beneficial? When you run slow, you use your quads and the deeper muscle in your calf called your soleus. When you run fast, you use your gastroc, which is the bigger, thicker muscle at the top of your calf, and then your hamstrings and your glutes. So if you're overworking one muscle more than another, then that's just going to get pissed off. So we want to try and revert that, trying to use and bring in muscles into your running strategy, and that's going to give you an all-around better feeling of strength in your legs as you're doing it. Now, are we trying to kill you doing the sprints? No, not at all. What distance should you do? If you're doing 100, 150 meters, you're doing it at a pace that's well above what you normally run at, then you take a 60-second rest. Repeat that over 5 or 6 times. You get a nice little workout. You don't piss off your knee, and your hamstrings and your glutes start to work. Then the last thing is that if you're really keen on keeping quite strong as you run, is get into the gym. Our target areas you can work on at hamstrings. So you can do hamstring sliders. Again, there's loads of YouTube videos on this. Calf, you want to work on your calf muscles, so you can have single leg calf raises or bent knee calf raises. And then finally, if you want to kind of get your glutes kicking in, you can do single leg bridges. Now, all of these, loads of videos on YouTube, to go check them out. But they're 3 simple tips that if you keep the basics right, will be able to keep you running. But if you increase the distance too much, you're going to make shit of it, and you're going to be spending money coming in to see us. Hope that helps.